You can heal if you take care of your diet and your body. Stop owning diseases. It's not your ulcer, it's not your infection. Today let's talk about infections. Most women and men keep wondering whenever they visit the hospital or health center, they report that they have infections. They normally run the tests. Most of the tests they run is a CBC. Once it shows neutrophilia, now it means you have some bacterial infections. But let's differentiate some of the common infections that normally suffered in women and in men. One, we're going to differentiate the UTIs and STIs. UTIs are urinary tract infections, then STIs are sexually transmitted infections. Let's start with urinary tract infections in women. Most common infections that are in women. One, we have acute cystitis. Acute cystitis is where a patient will present with frequent micturition, like frequent passing of urine, foul smelling urine. Then we have itching around the vulva. They pass small amounts of urine, and sometimes it is itching. The most common organism that causes cystitis is E. coli. Risk factors. We have people who are suffering from diabetes. We have pregnant mothers, because once the pressure of the baby compresses the urinary bladder, and the bladder will not be emptied fully, so there will be remaining urine, which puts you at risk of getting that infection. Then we have 70% of those cases are caused by anatomical distance between the vulva and the anus, whereby once they are maybe urinating or defecating, or how do we call these practices, cleaning themselves, they don't clean themselves well, so they put themselves at risk. Even sex can be a risk, because once you can get that normal flora, which always resides which normally resides in the vulva, and you infect it, it attacks the bladder, then you get the infection, what we call the cystitis. Secondly, we have a bacterial vaginosis. Vaginosis is a common infection that is in women, and it's normally brought about by health workers and even the patients themselves. How? This is a condition that is not sexually transmitted, but it is due to lifestyle of especially women who normally do dodging. They use a lot of tampons, then they use scented soaps and V-washes. Then to the health part of it, we have indiscriminate prescription of antibiotics, what we call abuse of antibiotics. They can put you at risk of getting bacterial vaginosis. Thirdly, we have what we call a vaginal candidiasis. A patient will present with a foul smell. They will present with a discharge, which is whitish in color, and sometimes itching around the vulva. That one is caused by Candida albicans, and it can be treated. Now, those are the common urinary tract infections that are normally faced by women. Then, now we'll go for sexually transmitted infections. Sexually transmitted infections, we have AIDS, but minus the AIDS, we have the STIs. We treat them as syndromes. So we have urethral discharge syndrome. Urethral discharge syndrome is common in male. The urethra becomes inflamed, and there is pus discharge, and there is pain, and sometimes caused by gonorrhea, and for it is because of intercourse. Then we have abnormal vaginal discharge. That is common in women. It is actually in women. We have talked about, can be a candidiasis, it can be caused by a trichomonas vaginitis, treponema pallidum, like syphilis and what. So you find they have a fishy smell, a foul smell, or a whitish discharge and what. So that is what we call a abnormal vaginal discharge. Then we have a PID, what we call a pelvic inflammatory disease. Pelvic inflammatory disease comprises of cervicitis and salpingitis. Cervicitis is the inflammation of the cervix, that is the infection of the cervix. Then salpingitis is the infection of the fallopian tubes. All of them are sexually transmitted. Then we have genital ulcer syndrome. Genital ulcer syndrome. Genital ulcers are, you get blisters, especially at the tip. This is common in men and also in women. They get blisters around the genital parts. So also it is a sexually transmitted infection. So whenever you come for a hospital visit and a health worker tells you that you have an infection, please inquire and know which type of an infection am I having. Sometimes patients can be having both sexually transmitted and urinary tract infections. Should inquire which type, which specific infection am I suffering from, and they give you the right medication for you to be fine. Otherwise, thank you so much for watching. Subscribe, share, and comment for other episodes.